A staggering 20,000 girls in the country seek care for abortion-related complications every year. The World Health Organization reports that each year in Kenya, at least 3,000 women die of unsafe abortion-related complications, and 500,000 more suffer short and long-term morbidities. Abortion is illegal in Kenya, but sexual and reproductive health and rights advocates have been calling for full implementation of a policy and guidelines that permit abortion by choice. The right to terminate pregnancies continues to be one of the most contested debates across the world, even as the world observed World Safe Abortion Day this week. In Kenya today, 700 girls between the ages of 10 and 19 are getting pregnant daily. Many lose their lives trying to procure abortions in backstreet clinics. This is Machakos Level 5 Hospital. Here, Ward 10 is a gynecological ward for post-abortion care services.
Nilikuja huku Monday, nilikuwa na shida ya tumbo. I was five months pregnant. Na ilikuwa inanisumbua sana.
Some mothers come with severe PV bleeding, that is hemorrhage. Others come with sepsis who have procured abortions. In our ward, we have diagnoses like inevitable abortions, we have molar pregnancies, we have incomplete abortions, we also have septic abortions.
The ward is a busy one.
In a month, we do get around 37 to 40 clients, and in average, in a year, since October last year, since we were trained by the Ministry of Health, we have attended to 355 clients.
Nurses here are also trained on post-care counseling that helps them fight the stigma around abortion.
We give post-care counseling because it is part of the elements of post-abortal care, where patients make decisions on their future, whereby family planning services, we talk about it to the patients.
To prevent unwanted pregnancies among the patients they have treated, they provide them with contraceptives because there is no denying that they are sexually active, however young they may be.
We get girls as young as 14 years old and to the extreme ages of 44 years.
Abortion is illegal in Kenya and is only permitted when, in the opinion of a trained health professional, there is need for emergency treatment or the life or health of the mother is in danger, according to Article 26 of the Constitution. But in a landmark ruling, the High Court of Kenya in Malindi affirmed that abortion care is a fundamental right under the Constitution of Kenya and that arbitrary arrests and prosecution of patients and healthcare providers for seeking or offering abortion services are illegal.
In Machakos Level 5, we don't procure abortions, but when already the abortions have been procured, when patients come, we offer the post-abortal care.
Sexual and reproductive health and rights advocates say abortion is not a morality issue, but a public health issue. They're advocating for abortion by choice. However, this does not sit well with many. After terminating 2 pregnancies, sinking into depression, and contemplating suicide, Akech Aimba resolved to use her story to help young women in difficult situations make informed choices.
My story started when I was 18, and I got pregnant out of a situation that I did not foresee. And in that situation, I sought counsel to somebody that I regarded as an authority figure, and they told me that abortion is the best way to go. So when I chose abortion that first time, I felt like it had solved my problem. So the second time when I got pregnant, I chose abortion again because I was able to, go back to college and handle my life after the first abortion, and it felt that doing an abortion again will help me.
Akech says that apart from the excruciating pain of terminating the pregnancies, she suffered worse emotional pain.
The abortions gave me a relief for a while because now I was not handling the crisis anymore. But then after that, I started suffering psychologically and emotionally through what we called post-abortion syndrome or post-abortion distress. And this is the inability of a woman to cope with the feelings or the emotions that come after an abortion. Because when a woman procures an abortion, is actually losing a child or killing her own baby. And when you lose a family member, you have to grieve, you have to mourn. But for abortion, for what abortion is, women are not allowed to grieve, they're not allowed to mourn because they come face to face with the fact that they killed their own babies. And so that's why they go through what we call post-abortion syndrome or post-abortion distress.
It is at this lowest point that she started to question her purpose in life.
First, I decided to start sharing my story. And when I started sharing my story, I had women come to me and tell me I am going through the same thing. And then I decided that I was going to start an organization to reach out to these women. But I didn't want just to reach out to women who've had abortions. I wanted to reach out to women before they had this abortion. So then I started the crisis pregnancy counseling services where we reach out to women in crisis, faced with a crisis pregnancy, so they don't choose abortion. Then I told myself, oh, let me not reach out to women who are already pregnant. How can we help women not to get pregnant out of marriage so that they have to choose abortion?
Akech founded Pearls and Treasures Trust in 2010 to reach out to other post-abortive women and young girls in crisis pregnancies.
What informed the birth of Pearls and Treasures Trust is my own pain of abortion, is the things that I went through, the emotions that I had to fight, the disorientation that I had after the abortions, that informed me that there are women out there who are suffering the way I suffered and they need help.
She says that babies are a gift from God.
So I would not advocate for abortion at any time. And there is nothing like safe abortion, because when you're doing a procedure that terminates one life, it is not safe for anyone, because that woman may have a life to live, but we've killed a baby. So how was it safe for that baby? You know, any doctor or any hospital has the mandate to keep every human being, even the one in the womb, to have life. They're supposed to preserve life. So any hospital and any doctor who is performing an abortion, they are abortionists, and hospitals are called abortion mills. They're not hospitals anymore.
Globally, unsafe abortion is recognized as a major public health concern.